Hey everybody, we are now live on two different channels. So this is Keith with PrevailOverCancer.com, and he's on Instagram, and I'm Paul with Hyperbaric.plus, and we are on Facebook Live. And we've got I think next week we're going to expand. Ryan has found a way to be on all channels at one time.
Oh, that'd be nice.
We're going to talk to you about that as well.
Okay.
But Keith, as always, has tons of information at PrevailOverCancer.com, and some of the things we're going to be talking about there, if you had that open on your computer or on your wherever you may be, might be something to refer to as we go through this. So today we're going to talk about assess, don't guess, lab testing, and if you've ever watched Keith talk, I'm sure you've heard that line, because that's what he tells all of our clients. Don't take a guess at it, assess. So anyway, I'm going to turn it over to Keith. Take off there, sir.
Okay, great. Thank you. So thank you for tuning in at Hyperbaric.plus and Prevail Over Cancer. And so lab tests. And it's going to be pretty broad, and we're actually going to go back and forth quite a bit. So, my concentration is going to be in cancer now, and doing actually tests that your doctor isn't going to be doing probably. And so they're going to do standard metabolic panels and CBCs, which are important. I'll mention that briefly, and cancer markers, and those are important. But I'm going to go into other areas very important about genetics and blood tests and urine tests and at-home tests and things that you can do to monitor your body to find out how to improve your health. Whether it be cancer or not. So, as a matter of fact, even if you don't have cancer, you can do these things to improve your health. Matter of fact, so my family history is going to be Alzheimer's and cancer and cardiovascular disease. It's the same thing. We have to do the same changes for all of that. So, we're
I want to throw something in here that I hear from my clients all the time. They think that they're going to go down the path of non-recognized therapies, meaning off-label or outside the box, and so they just give up on their doctor and walk away.
Oh, yeah.
It is really important to try to maintain that relationship. If you decide to go off rails or whatever you want to call it, if you want to do some of these other alternative therapies, try to maintain that relationship with your doctor so they will continue to do all the possible tests that you can do. And you never know what insurance is and is not going to pay for.
Right.
So ask your doctor, hey, I've got an interest in doing this, and see if he can get that approved through your insurance.
Exactly. Use those benefits.
Don't just give up on it. Yeah.
Use those benefits and keep your practitioners involved. And part of it is, so you can use those benefits, but also part of it is so they'll learn.
Exactly.
And it takes time for them to accept some of these things. So, when we have a health challenge, whether it be cancer or Lyme's, we do a lot with Lyme's and actually mold in these sessions that we're in for the hyperbaric chambers. Well, we get kind of a warning light that goes off. And so, like on my truck, when that warning light goes off, I have to use this. So how many of you guys know what this is? Okay. You have to, when that check engine light goes off, or comes on rather, let's put it that way, when it comes on, you got to do something. If you don't, you could run into a problem. And so you have to stop and you have to plug this in to find out what it is. So I've used this machine in the past 5 years probably 50 times between myself and friends and coworkers, and to find out what's going on in their car or their truck. So it's very important, and it can actually reset that code. That's temporary. It's not getting to the source of the problem. Okay, so we have to get to the source of the problem. This is for a car. This is not for the human body. So, but there are other tests, and that's just a prop. And Paul's got some more things too that he does here. There's many things that we can do to evaluate our body and get a number, and so that and I'm big in that because of my background with pharmacy. I like to know a number and test, make a change, and then test again. And it's like a blood pressure cuff. We want to make sure that what we're doing is working.
Man, we just heard a story in the chamber about somebody dealing with brain cancer. He didn't call it glioblastoma because he's not there yet.
Right, it's not there.
Started 10 years ago, and he called it a liquid biopsy. And so he's getting these numbers now because it did pop up again after 10 years. instead of just running off and doing chemo and radiation, he's got a number that he can follow, and that number's not moving. He made lots of changes in his life where he had kind of fallen off the wagon, as he said. And so now he's got a number he can follow, and he's doing all the things he can before he ever goes back, to possibly doing chemo and radiation.
And it's guiding his decision on what to do.
Exactly.
So, the
And
doctors
it's not imaging. I mean, it's not.
Right.
I didn't know until today. I've never heard of that.
there are liquid biopsies for different types of cancer where they can actually measure those cancer, a lot of times like the DNA of the cancer cells in the blood. Or in a tissue or maybe a cyst liquid or something like that. Pancreatic even, they're doing that now. They're actually taking a fluid from the cyst in the pancreas and evaluating that to see if it's a precancer or a cancerous type issue. So, but there's liquid biopsies available, and they're becoming more and more common. With that.
I thought I knew.
It's like the RGCC test.
It's
Yeah,
kind of like
that's what I was
kind of like
saying, kind of
RGCC.
technology.
Yes, RGCC. So matter of fact, there's no way, in 30 minutes that we're going to cover everything. Okay, no way.
Especially with Conrad, he's sitting next to you.
And so, well, not just that, just even with like. Matter of fact, I even forgot to put something on this sheet. So this sheet actually is not on my website yet. It will be. I have a blog post, on my website about assess and don't guess about lab tests. So it's at the top. So if you're watching this this week, you'll find that. It's going to be on there this afternoon. I didn't have time to do that this morning. And then I forgot to put one test on there, because there's many tests. Now, these are also tests that your doctors typically don't do, but are very important. And these are also not tests that, I'm doomed. No, it's not. These are tests that you can make changes on and make corrections and then follow up to make sure that that's working right. So, and the one I forgot today, which actually is a thing that we deal a lot with, in our sessions that we have here, is mycotoxins. And so mycotoxins are chemicals that are released from mold, and those can be inhaled or consumed in food and get into our body and increase risk of several cancers, especially along the lines of renal, which means kidney cancers, but even other cancers too. And it's actually a newer area that they're starting to evaluate because mycotoxin tests aren't common. So a blood test is not a common test at all. But I think, did you have a blood test? Okay, or urine test. Urine test is the most common on that. I've got a link on my website for that. So, but mycotoxins are very important, and there's many different health issues. As a matter of fact, I actually have, on each of these tests I'm mentioning today, I have a paragraph. So this blog post has over about 4,000 words on it. So, and it's not comprehensive, but that's just how much information's out there. On that. So I'm going to go through some of these and we'll stop. I'll take a break. I'll have Paul jump in. And so a common one actually that your doctors are going to do is going to be a blood glucose and A1C. So a fasting blood glucose, if it's above 100 or an A1C above 5.5, that's a concern. And so that means above 5.5, blood glucose is starting, going up at times. Cancer loves sugar, and sugar is one of the fuels for cancer. So once again, more information on my website about that. Ketone bodies. So ketones are chemicals that are released when we burn fat for energy, and it is an energy chemical that our brain, and our heart, our body can use it. Cancer cells struggle with that, and so. And I do like intermittent fasting because I like to go back and forth. I like to do some ketosis, definitely. That means burning fat for energy, and then fuel our body for a feeding window, a eating window, and then go back into ketosis. I think that's a very important type thing, but it's easy to test for with actually a finger stick. You can get blood glucose and ketones both with 2 drops of blood, and get instant at-home results. That's a Keto Mojo machine. And I like to do that like 2 hours after a meal. And so we want that blood sugar 2 hours after a meal, to be less than 115. So fasting blood glucose, 100 or below after a meal, less than 115, and 110 is ideal after you eat. So, and then zinc and copper ratios, and some of these things we've talked about before, but copper excess, we have to have copper, but an excess is actually allows new blood vessels to grow to cancer cells and creates even some inflammation. It's a growth chemical. We have to have it. We have to have some. And then, but if we have too much copper, we have low zinc. Zinc's critical for the immune system, for lymphocytes, T cells, natural killer cells. So we have to have that combination, and that ratio needs to be, very tight, in there. So actually, there's a urine test, actually a blood test available for that, rather. Very important. And then heavy metals, mercury and lead, arsenic, cadmium. Those are common ones. There's many others that can be concerns, but those are common ones, often available as either a urine test or a hair test, uncolored hair. So ladies that dye hair, we have to get hair roots, actually closer to the root, no hair color, because guess what's in the hair color? Metals and chemicals. So, as a matter of fact, ladies that dye their hair a darker color have an increased risk of cancer versus ladies that don't dye their hair or use a lighter color. You know what I'm saying?
I just always, one year I played Santa, and I went and got my hair where they changed it
To white?
to white.
Uh-huh.
And why in the world women do that?
I
had to yell uncle. They said, you may not be able to handle this. I said, man, I'm a man. And I yelled uncle. I said, okay, I've had enough. So anyway, yeah, don't put that stuff in your hair.
And as a society, and it's not just new, but as a society, we have this belief that we have to have hair color and makeup and eyeliner and lipstick and things like that. We don't. And so that is wrong, and I'd like to gravitate away from that. Although, once again, that's not anything new. People have been doing that for thousands of years. So iodine is critical for the thyroid, but hundreds of different functions in the body. And it does seem to be only well studied actually for prostate cancer somewhat, but especially breast cancer. And so iodine helps normalize cells and helps them to be normal, kind of like vitamin D. Vitamin D helps cells to differentiate and be normal. Iodine's the same way. It's not well studied, but it is definitely a risk factor. Oh, a deficiency also, gastric cancers, also associated with that. Selenium, another kind of like a small mineral, kind of like iodine, doesn't require very much. Selenium is necessary. We have to have enough, it helps us to actually make glutathione, that helps repair our body, and many other immune functions in the body. It reduces oxidative stress. It helps control, it helps cells to be normal and to die like they're supposed to and not just keep replicating, go crazy. But we have to have a balance. As a matter of fact, I'm not mentioning that on all of these. We have to have a balance on everything. That's why we have to assess and don't guess. So an excess of zinc creates a problem. An excess of selenium actually increases the risk of some cancers. So we have to have that balance. So I don't take selenium myself, but I do eat at least 2 Brazil nuts every day to get my selenium in. So I try to go more food type items whenever possible. Urine and saliva pH, we've mentioned that several times before, so matter of fact, you can go back and kind of check some of the videos that we've done. An acid body weakens the immune system. Matter of fact, an acid body also literally increases the risk of bladder cancer. And so I see that actually pretty often. Almost every client I have with bladder cancer has very acidic urine. But that weakens the immune system, it damages the bladder lining and helps cells to start going abnormal and increases that risk. It weakens the immune system. Cancer cells actually make lactate dehydrogenase, or LD or LDH, or the blood tests for that. So those are some tests. Did I put that in here? Yes, I did. So that's another one later. So that's a blood test that measures acid that's made by our body, but cancer cells make a lot of it. And one thing that happens with it is that acid actually blocks out and keeps the immune system from going in and attacking the tumors. So lactic acid, or LDH, is actually a marker that I use, and I want to see that LDH number come down. My risk, so genetics. So we talked about genetics today earlier in the session, but there's one test that actually is testing more general type things, and it's not cancer, most cancers are not genetically caused, but we have genetic tendencies that allow what we do to create a cancer problem. For example, my vitamin D receptor doesn't work. That's called a VDR. And actually, I got that from, there are several companies. I use 3X4. What was the company y'all were talking about?
23 and me.
No,
MaxGen Labs.
MaxGen Labs. So my VDR receptor doesn't work from both parents. That means my immune system is not going to be functioning 100%. The immune cells are still there, but the vitamin D can't attach to the immune cells, and so now they're not going to function 100%. That increases my risk of heart attacks, strokes, Alzheimer's, and cancer. My whole family, no wonder, okay? So, but it doesn't mean that I'm going to get those early, but it means I need to be making some changes to adapt for that. Well, there's another test that's called My Risk, and it actually tests for 48 different genes that can increase the risk of cancer. And so there's ATM, BCRA, but there's a whole list. Now, every cancer doesn't have 48. And so actually most cancers only have up to half a dozen, maybe just a few. But if you have that genetic marker, then you can make changes with your diet and your supplements and your lifestyle and medications to help compensate for that. So these are not doom genes. You know, these are genes knowing that, okay, I've got this, I need to make these changes. MTHFR, one of those genetic markers, and so MTHFR is a methylation converting folic acid into methylfolate becomes a problem. I have that also, and so therefore I have to take a methylfolate. But knowing that, I take the methylfolate. If I take folic acid, that's going to increase my risk of cancers. So MTHFR, if you do the test by itself, it's like maybe $90. But you can get it in combination with a $300 test with maybe 60 or 70 other markers.
Yeah, I think that MaxGen test, it's like 120 markers.
Yeah, 120 in the MaxGen. 3X4 is 100-something markers, in that. So it's really, it's a bargain. The machine can do 100 of them for just a little bit more than just one test. And then I'm going to pass it off to Paul. Paul, you've got some tests. So let's say there's a mycotoxin issue.
So if there's a mycotoxin issue, what you're holding there is a thermal gun. It's a $100 gun that you can buy. This particular one, I don't even see the name on it. But what you're looking for is thermal imaging camera, and it's a Go-Yo Joe. Isn't that neat? Go-Yo Joe. But anyway, I think some of our viewers have watched Shy on here. Shy went and bought one of these, and she's loaned it to several of our clients. And they take it home and they look for hot spots. So
Cold spots.
Well, cold spot.
Cold spots in the wall.
Cold spots, because the mold is not going to be the same temperature as the rest of the background. So again, I'm not familiar with this. She has educated my clients how to go use this. They walk around their house and they look for those cold spots. I didn't know that.
It's cold. It's actually water.
Right. Okay, I get it.
The water and evaporation creates a colder spot.
There you go.
And so you can use it, around, especially where your refrigerator is, where your windows are. Matter of fact, I've got a window leak I've got to fix. And so I've got to fix that because that's where the water's coming in, and that's going to damage that wood, and therefore this is going to show cold because of the evaporation of the water.
So that's a very, there's so many things. I was going to start, I'm just going to cover a couple of them. You
Okay.
can call on me again in a minute.
Okay.
But one of the easiest ones that doesn't cost any money is if you're a client here, I want you to do a self-assessment every time you come in, because things are going to change, and if you don't document it, you won't see those gradual changes over time. So there's like 35, I think, that you're going to put 1 to 6, and it's all automated. It's on your phone.
Kind of like a symptoms assessment?
Yeah, exactly.
Okay.
It's self-assessment of symptoms. And it's amazing how all those change over time when you're coming in diving. Then the hit check is another one. It's an app that goes on your phone. If you're one of my clients that comes in with a concussion, we want you to have a record of where were you the day you came in and you had that symptom. And then when you're symptom free, take that test again and see how far the needle moved. The same thing with the right eye. Anything that's cognitive, we have all of our clients when they come in and they start a series of sessions, we want to know where they started, because we want those measurable results. And I'm pressing my clientele to notify their insurance company. You know, they usually come in here after they've exhausted
Right.
everything else. Well, we have insurance for a reason. If my doctor runs out of ideas and I come and I pay out of pocket and I still move the needle, I still get better, why can't I give that to my insurance company? And people go, well, that'll never happen. Well, all the measurable results that we will end up talking about at some point, if we have that proof, if we have that data, and we as a society start demanding that of our insurance company, then we can move away maybe from only one option.
Right.
You know, I just want options. I'm going to go the medical route, but if I get to a plateau, I'm going to look for options.
That's right.
So that's why it's so important in all these. I got a lot of people with renal failure diving with me, and I demand that they give me their labs. If they won't do it, I get it, and I make a spreadsheet, and I put the number of dives, and I put how the numbers are changing. That's something, if you're not going on dialysis, which I've got a client.
That's right. We've been talking about that.
Yeah, I've got a client that 2.5 years ago, she was headed to the dialysis clinic. And we've been able to keep her numbers today are better than they were 2.5 years ago. And that just doesn't happen with renal failure.
Right.
So she's paying out of pocket to come here. She's saving her insurance company a tremendous amount of money in dialysis. At some point, I'm hoping that she'll take the bull by the horns and go and say, hey, I need to be reimbursed for
Right.
this. I didn't have to do dialysis. So anyway, I'll kind of stop there, and thanks for...
Yeah. Oh, yeah.
We'll get into some more of this later. And
So as a reminder for those of you just tuning in, so at hyperbaric.plus, on their website, they've got these things listed, like the right eye and what other tests.
well, I'm just going to be real fast and run through
Okay.
just because people are kind of blown away by my list.
Okay.
So the self-assessment, the hit check, the right eye, all that's cognitive. The MOCA test, if you have a cognitive decline,
Yes.
the Montreal Cognitive Assessment Test, the MOCA test is used by all practitioners to kind of try to have a baseline no matter where you're going. And it's something to look at over time. We just added 4 points. We went from 23 to 27 with one of my clients on just the photobiomodulation helmet.
Okay, good.
That's crazy. And if you're dealing with dementia Alzheimer's, that's something to stand on the mountain and shout, because it doesn't happen very often. But we're seeing it with our photobiomodulation helmets. Brain mapping. I've got a picture of brain map. There is a brain that's blue. That's very little energy. In 100 days, this is a different client. In 100 days, that's a brain closer to normal. Okay? So in 100 days of a photobiomodulation helmet only, that's all they did, we moved the needle that far. And that's data, that's technology. That's not, I feel better. I mean, so anyway, peak flow meter. There's an app on here. You download the app, and the peak flow meter is looking at how much volume do I have in my lungs and how fast can I exhale that. And when you can move the needle, I have a lot of post-COVID people coming in. So I have them do this before their first session, and it's amazing how many people on their first session, they'll move it 50%. And they've been dealing with this for a long time. So in 3 or 4 sessions, I see people plateau, and that doesn't mean they're back to normal, but we can assess that we're not moving the needle any longer, and it helps them make a decision financially, do I want to continue this? So they can actually see it track. It's on, when you do the peak flow meter and you put the data on your phone, you can put that peak flow meter and the data of a pulse oximeter, which go hand in hand. You can put this data and you can literally show on a line graph on your phone, you can track it over time and you can see that line graph improving.
So what are the lung issues, some of the causes that you've been kind of concentrating or that you've kind of moved into?
I'm not a doctor. I got people coming in here, and
Right.
I'm guessing that it's scarring from having COVID. It's
Okay.
lung scarring. And what does hyperbarics do? It works at the cellular level. It's going to improve your mitochondrial function, your metabolic function, And so it's at the cellular level. So what is it in your body? It'd be like I'm putting fertilizer on my yard. It may not happen immediately, but what's going to happen to that yard if you're putting the proper fertilizer on it? It's going to improve.
That's right.
Same thing when you get in the chamber and you're working at a cellular level. Over time, it's not immediate.
Right.
But over time, you're going to improve the function of your body, and God made our body to heal.
Yes, lungs can get better.
Exactly. And we're seeing it, and this is how we see it.
Right.
I can't tell you how many people are blown away how fast they improve their lung capacity.
So, matter of fact, lung health was actually one of my main areas of focus before I got into cancer, and with my wife's health issues. And so she had some scarring in her lungs, and we didn't know why. And now it's not there. And her breathing is better.
And you did that with
actually curcumin and NAC.
yeah, there you go.
And so actually there's a product by Ultra Botanica. So Josh is here with us today. So their product, they have a curcumin and NAC. And it's amazing how well that did. But also now another area that you work with also is some veterans with burn pits.
Oh, yeah.
That's where I was trying to lead you to.
I'm sorry.
That's
So,
okay.
yeah, our veteran community,
Yeah.
and, this all started, I guess, probably 3 years ago. We had all these veterans that were diving with us, and, we were focused on PTSD, which is why we do all the cognitive assessment, self-assessment. And then we had a guy come in, and he was, the cancers that are coming out
Yeah.
of the burn pits 10 and 12 years after their service. It doesn't happen day one.
Right.
In fact, the first person that came in that we were exposed to all this, he had no idea what he was dealing with. He was a police officer, and he went down on a traffic stop and almost didn't make it. They threw him in a patrol car and got him to the hospital, and he almost didn't make it. And it wasn't until they did a tremendous amount of testing and assessing and understanding that this was all coming from his exposure around the burn pits during his service. And then I'm just amazed at how many people come in here and we start talking about that, and we can get in front of it. Virtually every one of my veterans that have burn pit exposure, every one of them have improved.
Right.
Nobody's got worse. Now, their improvement is very wide-ranging, but they've at least turned the trend the other way, because without this type of intervention, it's going to be a downhill deal. And so if we can stop it, if we can turn it the other way, we've had really good success with that.
Yeah, good. So that's where
Thanks
I was.
for bringing that up.
That's
It's
kinda where I was
on
going.
my list. It's just way down.
Oh, no,
here.
there's so many things we can
Go
talk
ahead.
about.
Go
So many
ahead.
things
Let's
on
let
these
you
tests.
finish your deal.
So many things on these tests that we can go through and go over. So check that note there. And so yeah. So okay, then glyphosate. So glyphosate is a chemical that is in a herbicide that's used to help kill the plants. Dry plants like oats and wheat, they spray the field to dry it so they can harvest it all at once, so it's ripe and dry all at once. And so, matter of fact, I'm getting ready to make a post about oatmeal. And matter of fact, on the oatmeal packaging, it says may contain traces of wheat. On the package of oats. And so, and this is a general oat thing. It's not an organic version of it. So, but anyway, glyphosate, is definitely an issue. It helps. It kind of destroys the gut microbiome, creates some immune signaling issues, a risk factor for non-Hodgkin's lymphoma and other cancers. It's actually a developing new area. And so they're gathering data. The problem's been is that how can they test for it? Now there is a urine test for glyphosate, so it is it's a pretty simple urine test. At home collection, send it off to the lab, and if you're peeing out the glyphosate, you've got a current exposure.
I would say too on that with the herbicides and the pesticides, most of what they consider safe levels of ingestion are based on a one-time exposure, and they don't take into account that we accumulate that in our fat cells and over a lifetime or over a duration is where we become toxic.
Correct, yeah. And so, matter of fact, these are fat soluble. They're stored in the body. Mycotoxins are stored in the body, stored in the fat cells. Glyphosate is stored in the body. And a recent study found that came in from Europe this last month that even much lower than thought doses in mice or rats, in the rodent study they did, it actually increased the risk of several cancers, not just lymphoma.
A study in the United States, something like 82% of the children test above levels
And
of glyphosate.
82% of the children in the United States test positive for high levels of glyphosate.
And that has to do more with the processed foods.
Right, and processed foods, are those sources on that. So then also, I do a Dutch hormone test, and I've got listed the complete Dutch hormone test, but it does hormones and hormone metabolites. So not just estrogen and testosterone and progesterone, but it goes into 2, 4, and 16 hydroxyestrogens and estradiols, and actually those 4s and 16s are like playing with fire. And so they're worse than the original one. And so then worse than the original hormone, estrogen, progesterone, and testosterone. So, and even DHT is another part of that test, and cortisol, that's another test as part of the Dutch Complete, but cortisol test can also be done by itself. So elevated cortisol suppresses the immune system. And actually even high cortisol, seems to be even related to more inflammation in the body. Even though cortisol itself is an anti-inflammatory, cortisone, our body actually even makes cortisone. That's a prescription product. Cortisol is what our body makes, both of those, but too much of it is also associated with increased risk of inflammation. I mentioned LDH earlier, lactate dehydrogenase, or sometimes some labs will just call it LD. It's a measure of acid in the body. And if that number is going up, that means there's a greater tumor burden. If it's going down, that means less of a tumor burden. And then vitamin D3 and vitamin K2, I like both of those. K2 is not as well studied and as well known, but because it's kind of like a newer item. Most of us have been taking vitamin D for many years, 20 years. Vitamin K2 has been more like 5 years, maybe 10 years. But now we actually can test for vitamin K, and it is also an anti-inflammatory like D. It actually moves minerals and calcium into the bones better than D, helps pull plaque out of the blood vessels better than D. And so vitamin K2 is going to become probably, I think, actually more important than D as far as the impact on our health. And vitamin K2 is actually, it is a vitamin. Vitamin D is actually a hormone. So, but they do put those together. So there is a blood test where you can get both of those. The blood test is not terribly expensive. A cash non-insurance payment is like $119, including the lab draw fee. So it's not real expensive.
And if you're supplementing with those, you want to be supplementing with magnesium as well.
Yes,
to
and so
make sure that
so magnesium does help with the conversion of vitamin D into what our body actually has to use. So, by the way, I forgot to mention, if you have questions, comment, and Ryan's going to get those and print those off for us. And so we're going to have a Q&A time here shortly. So actually the cameras are so far away from us, it's hard for me to see, and probably for Paul too, but hard for us to see those questions.
Well, I'm not going to put my glasses on. Everybody
glasses
calls me
on.
an old man. When
So I leave mine are graduated bifocals. So yes, I just leave them on.
While we're waiting on those questions, I'm going to just hit a couple other things that we do. I've got a lot of stroke recovery clients that dive with us, and we do a walk test. And these are things you can do at home. Put a chair 40 feet where you're going to stand up out of a chair and you're going to walk 40 feet. You're going to turn around, go back to your chair and sit down and time it and take a video. I like to use my video camera, and the reason is it's got a clock on it. But even the gait, I mean, if you've known anybody with Parkinson's or stroke recovery or anything that's cognitive, just the gait and getting a record of the gait, it's amazing how that changes in here. I've got one of my clients right now that had a stroke 2 years ago, And so he's gone 2 years, and finally he's like throwing his hands up, what do I do to get better? And everybody's telling him how much better his gait is, how much he's walking so much better. Well, he keeps bugging me to do the follow-up test. I said, are you done diving? No. And I said, well, we'll do it when you're done. I said, you can do it any time. Get somebody. He goes, well, I want to know. So anyway, it's fun to kind of hold that carrot out there, and it's so important because he was 2 years in and his doctors didn't have anything else for him. So now all he's doing is hyperbarics. Well, he's doing 3. He's doing hyperbarics, neurofeedback, and the red light helmet. And all of his friends are telling him they can see the improvement.
Yes.
And he's a teacher. He just returned back to school.
Oh, got back.
He's been teaching for 2 years. And surprisingly, because I didn't know, when I met him, I said, so, he goes, no, I'm still teaching. And it surprised me because he was really struggling.
Right.
Yeah.
You know, whenever a person has surgery and physical therapy, and a lot of people don't realize that. Actually, I've had surgeries, my wife, and so we've had to go through these things with our walk and our gait. And the physical therapist, they say, okay, we'll walk from here to there, and back. And you don't realize, but they're timing you. They're seeing how long it takes for you to do that. And they're documenting it, and they're writing it down. That's an assessment, okay? So many of these things, it's not always just lab tests, and that's kind of what I'm talking about here, because I'm doing virtual type things, but physical assessments.
Another test that a lot of the pulmonologists are doing, especially around COVID, you've heard the 6-minute test, the 6-minute walk test?
No.
So you get you a pulse oximeter on your finger, okay, and you blow on the other deal where we talked about the peak flow meter, you can take or leave it, but put a pulse ox on your finger and you walk on flat terrain for 6 minutes and you're monitoring that pulse ox.
Oh, okay.
And if it falls down below, I think it's 91, you sit your buns down until it comes back up, and then you mark what is the distance and what is the time, meaning 6 minutes. So what distance did I cover in that 6 minutes? How many times did I have to sit down? You just keep a little journal, because when you start doing this, when you start doing some of those other therapies, and your doctor, if you got pulmonary issues, he's already been, like you said, you don't know what he's doing.
They're writing notes.
They've been monitoring that. That's how they monitor. Well, I like to have a little more understanding of what I'm doing, so I'm going to monitor my own.
Yes.
I'm going to go on a 6-minute walk, and I'm going to see how far I get and how many times I got to sit down because it dropped below 91. And I'm sure that number of 91 is all over the place, but you don't want to be, a block down the road and you run out of breath, and
right.
You want to monitor that pulse ox and take a break when you need to. But it's just another way to monitor our pulmonary health.
That's right. And so the matter of fact, I'll go back to the lung health. That was an area that I got into. As a matter of fact, I was actually using peak flow meters before cell phones were around. And we were using that, and we were able to show people and parents how their lung function was getting better. And so, matter of fact, part of that assessment, once again, a physical assessment, whether it be peak flow, had a young man, actually a child. He was trying to do ice skating in Oklahoma. Believe that. I didn't know we had that. But anyway, he was doing ice skating, and he could not complete his 3-minute routine, and without going into an asthma attack. And he was doing all the inhalers. And so then I talked to him about what he was eating. We modified that a little bit. And then I gave him magnesium. Within 2 minutes, he was doing his 3-minute routine. The lungs are a muscle. And so he needed that magnesium. Most of us only get less than half of what we're supposed to get in our diet anyway. And so we supplemented that. And that's about the same time I added magnesium to my wife's routine, and her asthma went away. Her migraine headaches went away. So it's amazing. So yes, monitoring, and this even, this little pulse ox actually told me when to take my wife to the hospital when she had pneumonia. And I kept following her, and that number kept going down, and finally I go, oh, it's time.
What was the trigger number?
So actually she got down to 85.
Okay.
85. and this was before COVID, but it was a virus infection. And once she got into the hospital and got actually a cortisone infusion going to thin out that congestion, she recovered very well. And as a matter of fact, antibiotics don't take care of virus infections. But anyway, her body was able to take care of that. But assessing, is important.
It was so long ago, I can't even remember what her age was, but I helped her coach my son's ball team, and she had asthma. And I got a call the next, we were at practice, got a call the next day she passed. I'm like, what? Well, she had this fluid on her lungs, and I don't know what that pulse ox, I don't know where that would have kicked in, but she had so much fluid on her lungs, they couldn't reverse it when she got to the hospital that night, and she passed.
Wow.
And it was, had no idea. That just blew my mind. It was crazy.
Yeah.
So.
Okay, so do you have any other
Well, what's
tests?
that? So we got a note from one of our...
So yeah, we're talking about lungs and continuing with the lungs. So serapeptase has helped remove lung scarring. And so yes, so serapeptase is actually one of my favorite supplements. On an empty stomach, the word ends in ASE. That means it's an enzyme. And take it on an empty stomach. If you take it with food, it's going to help you digest your proteins and not be absorbed. But take it on an empty stomach, so serapeptase and nattokinase on an empty stomach help open up circulation. I've actually seen improvements in people's carotid arteries by taking those on an empty stomach, that getting better within months, documented by assessments, ultrasounds of the carotid artery, but also helps eat away at, improve circulation and eat away at cancer tumors or scarring.
Natto will also eat away at fibrin buildups in the artery. So seeing the carotid artery changes, but same thing for brain.
Yes.
Any kind of fibrin, if you've got clotting issues, it will eat away at that.
Yes, and so nattokinase eats away at fibrin, fibrinogen, in the blood vessels, improves circulation. There's some lab animal studies, rats that are genetically bred and selected to develop Alzheimer's. When they give them the nattokinase on an empty stomach, they tend not to develop the Alzheimer's compared to the ones that did not get that. So we have to repair the brain. We have to let nutrients get up to the brain and circulate. So
we got some questions here.
Okay.
I got it's proven, so I don't know. I'm not going to say it's proven, but that's what our question is. I thought these were questions. Kind of pose these as a question.
Okay.
But it says that nicotine prevents and beats cancer and other COVID-like symptoms. Is it okay to smoke all natural tobaccos, and are patches strictly the only option?
Well, so
I don't know how to answer all those.
Yes, and so I've actually studied that quite a bit. And so there is actually a couple of studies showing that nicotine has a little bit of an anti-cancer effect. Yes. But not smoking. Yeah. So smoking is a no-no, and that's the problem. And so now the researchers are starting to think, well, maybe it's not the nicotine that is addicting, but it's actually the other chemicals that the cigarette companies added to the tobacco to create, more of an addiction, but also you're burning a chemical and you're breathing in the smoke. That is the problem. That's the main problem. That's where cigarettes, cigars, firefighters, people, burn pits, getting cancer, whatever, but breathing in that smoke is a problem. Matter of fact, I have an issue detoxing that out of myself. My genetic test told me that. So therefore, I'm very careful now around the campfire, grilling. I don't smoke my foods anymore because that damage actually increases my risk of cancer.
Isn't it also, it's nicotinamide?
So there's
nicotinamide.
That's a different.
Okay.
Yeah, that's a different one. So actually, this nicotine thing, it is a controversial, and yes, there are a couple of studies, but if you were to do something like that, it would have to be a more like a patch or a gum. But then I have problems about the patch and the gum, about the chemicals that are used to make the gums, and the patches. So, but anyway, to kind of answer that.
Well, here's somebody that wants to book a coaching call. How is that possible? How do you do that, Keith?
Oh, good. How about that? Good.
Yeah.
So actually, prevailovercancer.com, I have a coaching page, and matter of fact, you can just type in prevail over cancer however you want to, and it's going to pop up. And coaching, and there's a way to select that. I have a free 15-minute initial consultation, even just to kind of answer a question or two, kind of so we can learn about each other and find out if that's going to be a good fit. And prevailovercancer.com coaching.
Do you know about some cautions to use milk thistle with hormone breast cancer or prostate cancer?
So that's a common thing on the Facebook groups, on social media, that milk thistle has an estrogenic property and it should be avoided if you have breast cancer or hormone cancers. But the estrogenic property, like most plants, that estrogenic property is so weak, if it does attach to the cells, to that estrogen receptor, it's so weak that it doesn't stimulate the cells. Yes, it can attach to estrogen receptors, but it's going to now go and block those stronger, worse estrogens like the 4 and 16 hydroxyestrogens I was talking about, and it keeps those from attaching. So the net effect is, even though it has a little bit of an estrogenic property, that's where everybody's jumping on, but that net effect is it's an anti-cancer type thing. It also does help the liver to process, detox, and get rid of carcinogens too. So I do have a blog post if you want more information and links about that, about breast cancer specifically and other cancers about milk thistle. So I'm not concerned about that at this time. It's an evolving science. We're learning. Matter of fact, this is a wonderful time between social media and the internet and the research, and that we can learn this stuff very quickly now.
So 1 degree makes a non-glyphosate sprouted rolled oats. Do you think that's okay to eat?
Well, it could be, yes, and I'm not familiar with it, so I can't say everybody should go do that. But a glyphosate-free oat would be a better option. If you have cancer, oats have a tendency to have a higher glycemic index, and so, matter of fact, even actually, you'd have to limit to keep your blood glucose where you're kind of in barely have a little bit of ketones. You'd have to eat less than 1/2 of a cup of oats.
Sprouted oats will have a little bit less.
A little bit less. Okay. Did they say sprouted on that? Okay. So a sprouted would be a little bit better. It's kind of like a sprouted grains. For example, most breads, especially in the United States, have a high glycemic index. I mean, they are literally as bad as sugar. A sprouted grain bread, like Ezekiel bread, and I went blank on the other one, but like Ezekiel bread or sourdough, they barely raise your blood glucose. And so they're still not officially in what I call the cancer keto diet that I have on my website, but one piece of bread sprouted would be an option. So evidently a sprouted oat could be an option. Actually, it's so new probably, we don't know for sure what kind of impact it'd have, but assess and don't guess. That means test, and I didn't bring the blood glucose machine, but to take a finger stick after you eat and see what happens with your blood glucose and your ketones. And so if that one piece of bread kicks up your blood glucose, or that serving of the sprouted oats is a problem for you. Matter of fact, everybody's different. So we have, 8 or 9 of us here. We're all going to be different on that cup of oatmeal. Some of us can handle it, some of us can't. Yes?
How long after you eat would you
Oh,
take
yeah.
the test?
Okay, when to do the test after eating? Actually, I wait 2 hours. And so, because it actually is going to spike, immediately after eating. But we want to see about that 2-hour time period. So my goal is actually for me to eat a meal, and 2 hours after the meal, my blood glucose would be exactly the same.
And I would say too, on those, when you're focusing on keto, don't just focus on the sugar effect, focus on a clean eating diet, because there's a lot of tricks that they use to make the carb
Yes.
effect be lower, but it could be doing other damage. So, even with the rolled oats question, that would also probably depend on what else are you eating with
Right.
it.
Yes, and so I did have a discussion yesterday or the day before with a senior person, a senior male, and so that's a challenge. What is he going to eat? He's been eating oatmeal every day of his life for breakfast. And so, so he's kind of resistant to changes. And so it's going to be a challenge. And so I helped him to modify that. what to put into it, like protein and olive oil and a few nuts and seeds, and trying to get better sources of the oatmeal with that. So.
Well, Keith, we've pushed up to the
Oh,
hour
yes, we have,
again,
haven't we? Yes.
And there's a couple of questions
Oh, okay.
here that I'll have you review
Okay.
and answer, so we didn't get to a couple of them. But, man, assess, don't guess.
Yes, that's
I mean,
right.
that is, every time I see you, that's the first thing I think about, because you preach that all the time.
Uh-huh.
So, anyway, this is Keith with PrevaiLOverCancer.com. He's got a great website, tremendous amount of information. I highly encourage you to go check it out. And come dive with us. Paul at Hyperbaric.plus, come dive with us. We're fortunate enough to have experts in the chamber, and we always put that at the top of the title on each of the dive sessions. We have experts come in at different levels of schooling, at different disciplines, and it's always fun. You get them undivided attention for an hour.
We're trapped.
Yeah, you're trapped. So it's a lot
It's
of
great.
fun.
I enjoy it. It's great.
Yeah, a lot of fun. Well, hey, thank you again for joining us today. And next week, we'll figure out what we're going to talk about next week. Just tune in and join us.
Yes. Okay, great.
All right.
Okay,
Thank
thank
you.
you.